you look down, you see this bag. I think for a lot of people, it's panic. You're scared. You just, so many things going through your head, and you're the people that walk in and go, let me show you, let me help you. And
for me, it's so lovely to know that you're making a difference.
We're going to talk about some like common stoma issues. There's lots of people who speak to me worry about like sore skin. And there's lots of people that get like bleeding around their stoma.
It's that cycle of you have a leak, skin gets sore. There has to be something changed on it, but you don't know what it is. You put the bag back on, but then you've got sore skin on top of that, and that's going to continue that cycle until you break it.
Now, hernias is something that is a huge topic.
But there is ways to reduce it, and with a hernia, prevention is always better than cure. I've had patients who woke up with a stoma and didn't even know what a stoma was beforehand.
I can't imagine what that must feel like.
It's just important to be kind to yourself and all of that, and as you're going through that journey.
Okay, welcome to episode 2, guys. Back with Beyond the Pouch in our lovely new setting. I'm back with Ant.
Hello. How are we?
Good. Now, we have got I would say this episode is going to be something that people are really keen to listen to.
So, honestly, I'm so excited for this.
Now, we are celebrating International Nurses Day. Now, the nurse is the stoma nurse, that one of the first people we see when we wake up and have had stoma surgery. And for a lot of people, it's the first person that sees you with your bag. And I don't think that ever leaves you.
No, it doesn't. And you can have like really strong relationships with your stoma nurses. And like, hopefully all of you like regularly see your stoma nurses and genuinely like get on with them. Like I know when I had my stoma for the first time, my stoma nurse team were incredible. They were so helpful. They answered all of my questions. And today, we're going to be answering so many more questions to the wonderful Lucy, who's going to be a former stoma nurse and a clinical advisor for Ekin. I can't wait to get her on and just get to know more about her and these topics.
We're going to be covering things like ballooning, pancaking, hernias, odour, blockages, the work. So if you have that kind of thing going on and you want to hear from an expert, then this is the episode for you.
Let's get right into it.
Let's do it.
So, second episode of Beyond the Pouch podcast. We have the lovely Lucy with us today that's come all the way over from Ireland. And I'm so excited to have you on. We're going to talk lots of things today around stomas, like the nursing side of things, because we're going to have a lot of listeners that will be really key.
This is going to be a good one.
Oh, it's going to be exceptional. But before we start, can we just have a little bit about you, how you got into like your field, your areas of expertise, stuff like that?
Absolutely. And I just want to say it's an absolute privilege to be here and to join you today.
So thank you. Stop it.
So much for having me here today. So I have to be completely honest, when I started nursing, I didn't know what a stoma was. I still remember the first time I seen a stoma and I had all the thoughts, is it painful? Can it get infected? All of those questions. And it was just really interesting to learn about it. Then I spent, again as a student nurse, I spent a day in the outpatients department with patients coming in who were out in the community with their stomas. And I just remember that day feeling so good going home, because I just thought that so nice. It was so lovely to be able to support patients that are a lot of the time maybe just after finishing their chemotherapy journey, if they've had a cancer diagnosis, or with IBD and finding this new lease of life now that they've had a stoma. So that's really where I'd piqued my interest in wanting to work in stoma care. And then in 2014, I started working in stoma care. Amazing. And along with that then, I really wanted to understand from a psychological point of view how I could support patients a little bit more. So I think it was 2018 then I started a degree in another degree in counselling and psychotherapy.
Wow.
So I'm also an accredited counsellor and psychotherapist as well.
It's a triple threat.
Yeah.
And so I work in both at the moment.
Amazing.
And it's coming up to my year anniversary now, working as a clinical advisor with Ekin, which I absolutely love.
Oh, that's fantastic.
Yeah.
So is that like more, forgive me, things like CBT and stuff like that?
My psychotherapy, is it? Yeah. So it is, when I didn't know what I was going to do, and like everything in life, it's not a one size fits all for us all. Yeah. So my degree was in an integrated. So what we did was humanistic, which is very much just allowing the client to discover where they want to go with it. Yeah. Psychodynamics is very much looking at childhood and how that would have shaped us. And also CBT was an element in my undergraduate.
So interesting.
And now I'm currently doing a master's in CBT just to improve that as well. So I absolutely love CBT, and the power of our mind just fascinates me.
So if anyone's got you as a stoma nurse, they are winning.
Yeah.
They've got like,
that's incredible, isn't it?
God, that's amazing.
And to a certain extent, actually, probably I thought it would change me an awful lot more as a stoma care nurse, but I'm very good at setting those boundaries. I don't think that you can be a stoma care nurse and a psychotherapist to the same person. So I'm very aware that in my role, I'm a stoma care nurse, and in another role. And I have worked with a lot of people in my psychotherapy journey who have stomas, but I wouldn't be their nurse as well. So I do think it's important that I keep those boundaries.
Has it helped you though? Has it made you see things different, or do you strictly keep, there is no crossover at all?
Oh, it's definitely helped me. Just understanding even the mind-body connection. You know, our thoughts impact so much on the body. When we're anxious, we tense up, and that's a huge part of it. So it's definitely helped me and given me a much better understanding. But do you know what it's really, really given me appreciation for is how amazing nurses are.
You all are, honestly. Gosh.
So it's just, it's helped me with that as well. And the more I do in it, the more it's such a privilege to be a nurse as well.
Oh, what a journey. What a story. It's incredible.
Yeah.
So you started your career not really knowing much about stomas, then you fell in love with it, like helping. I've got to be brutally honest. I can't thank you and all the stoma nurses out there enough. It is probably a thankless task. You probably don't get a lot of people saying thank you for everything you do, but genuinely, bottom of my heart, we'd be nowhere without stoma nurses.
Yeah.
I'd have absolutely no idea. I wouldn't know how to, I'd figure out putting a bag on, but knowing me, I wouldn't know if it was working.
You're the first people when we wake up. Your surgeon doesn't come and see you, do they? It's your stoma nurse normally. And you look down, you see this bag. I think for a lot of people, it's panic. You're scared. You just, so many things going through your head, and you're the people that walk in and go, let me show you, let me help you. And
And it might sound corny, but I just think that's such an honour. It's so lovely to be able to go and support patients when they wake up on that journey. So I don't see, and I have to say, I think patients are really, really, really appreciative
of
it. Yeah, and we do hear it quite a lot, and it is lovely to hear. But for me, it's so lovely to know that you're making a difference to people's lives.
Massively.
And we can't always get it right. We're not perfect, but it's just doing our best with it as well.
But it's having someone there, isn't it? Just a human that knows about it. Because some people, they might not even, it might have been an emergency. They might have not even planned it. Yeah. So for you to come in and go, right, I am a stoma nurse, I can help you. It's massive, massive, huge.
And I suppose I'm so conscious, we do it all day, every day. I might see, I don't know how many stomas a day, but every person that I'm going to is only seeing their stoma. That's, so I'm always mindful that to me, I don't give it a second thought, but for somebody who's newly getting a stoma, it takes up a lot of space in their thought process.
100%. And also, from a patient's perspective, you're the person with all the experience, and my own experience with stoma nurses have always been good. I know some people don't, but hearing that you're so caring, you want to help people, honestly is really refreshing. And also just it's genuine. Do you know what I mean? There's so many people that won't get that connection. And part of today, good segue again, is we're going to talk about some common stoma issues. Now, how long have you been a stoma nurse for again?
I've been a stoma nurse since 2014.
Wow.
So I started then.
Oh, the things you must have seen.
I know.
It's a shame you didn't bring videos and photos and you couldn't show us visuals, so you're going to have to describe stuff for us.
Yeah, well, I suppose it's very much just general talking today because everybody's so different. Yeah. So it's just very general overview and some advice. Some will work for people, some won't. Yeah. And it's just... I don't know how you feel when I say this, but I do think sometimes it's trial and error.
100% it is.
Massively, because there's no one answer fix all, is there?
No.
And everyone's stoma is different. Everyone's stoma behaves differently. Yeah. I had stoma surgery for the second time in 2020, and then I had it refashioned 5 weeks later. Yeah, so I've had 3 stomas, and not one of them was the same. Not one of them was managed the same. And it's for you to be able to... help everyone with their different stomas. The knowledge and the experience you must have accumulated over that time is massive. So let's get into it.
Yeah.
Let's get into it.
One thing, now I don't really experience this. I don't know if you do.
No.
But I hear ballooning a lot. Like, what is that?
Yes.
Like, does that mean my stoma bag's going to take off? Like, what is it?
So what that means is we are all passing wind. It's natural part of the digestive system, but it goes into the atmosphere and nobody notices unless there's a sound with it. But so what happens when you have a stoma is we're still passing wind, but now it's going into a bag where it's going to be contained. Now there is filters, and filters have come on so much in the last few years, and they're they're continuously improving, but they can only manage so much wind.
Yes.
So if for some reason you're producing more wind than you would have before, or if something's changed, there's nowhere for that wind to go while it's waiting to escape out through that filter. So that's when you get the ballooning around it.
Ah, I see. So it's nothing to do with like air getting in from like outside the bag. It's just you.
It's
that makes
just
perfect
what we
sense.
naturally pass. Yeah.
So then, like, are there certain types of food or like dietary things that can help reduce wind output and ballooning?
Dietary, absolutely. And I don't tend not to go into specifics around diet because everybody is different.
Yeah.
I could recommend one to one person and they could say, oh no, that causes me a lot of ballooning, and something else to so everybody is different. But what I would say is even trying a natural yogurt, that can be good to promote healthy bacteria in the gut, and that can improve it as well. As we're talking, we're swallowing air. When we're eating, we're swallowing air. So there's little tips. Even try and have your main meals throughout the day. Take your time when you're eating as well.
Yeah, 100%.
And I was only talking about it the other day, when I'm eating, from working on the wards, I still eat so fast.
Yeah, wolf it down, get to your next job.
Yeah.
I need to be more mindful about my eating as well, and just slowing it down as well. What a lot of people find as well is in the morning there's more air in their bag than normal, and I suppose there's a lot of time where it hasn't been emptied.
And you're relaxed when you're sleeping, and
well, it's your natural alarm clock for me. Wakes me up at 5. It's like that. Hang on, just get out of bed.
And if you snore, or even if you just sleep with your mouth open, you're going to swallow more air as well. So there's those little tips as well, and that's hard because we don't know when we're asleep, we don't know what position our mouths are in.
No.
So there's all those little tips. How to manage it. If you have a drainable bag, just in the privacy of a toilet, just let some air out of it. If you have a closed bag, and it's often more common with colostomies, so if you have a closed bag, maybe just try a 2-piece if it's a big problem, and then you can let it out if you don't have to change the bag as well.
I suppose you don't have to keep changing your whole bag when you've got
just
wind.
for air.
I know for me, one thing that I experienced was wind pain.
Okay.
Post-surgery, my God, it was all in my lower back up to my shoulders, and it was brutal because we're on the topic of wind. And is that something you see commonly after stoma surgery because your bowels are being handled? And
absolutely, there is that adjustment phase after surgery, and it takes a good few weeks, and everybody's different, but we normally say it takes about 6 weeks for all that to settle down, even a little bit longer. So that's all very normal part of getting a stoma in the first place. Just your bowels you've just said it there, they're after being handled, they're after being moved around, so they need to just settle down.
I think peppermint tea was recommended by my stoma nurse.
Peppermint tea.
Peppermint tea, or if you don't like peppermint tea, peppermint capsules can be good as well.
There you go.
So that's it. And that's for anyone who experiences wind. That's recommended for bloating and wind, so that can be helpful for anyone.
There's one thing that I've started to notice actually more after surgery was when I first got my stoma bag, trial and error to your point, like finding the right bag that works for me. Fortunately, obviously, Modivine, the Pelican bags and Ekin bags at the time have massively helped, but like lots of people who speak to me worry about like sore skin. And there's lots of people that get like bleeding around their stoma, or like it almost comes like little holes like some people see and things. So have you got any practical tips or recommendations to help those patients?
Absolutely. Going back to your point, in those early few weeks after you have a stoma, there's going to be a lot of oedema and a lot of swelling around your stoma for the first while. So it is just keeping an eye as that swelling is going down. So it will drastically reduce in the first 6 weeks.
Oh gosh,
so
because you're constantly like you wouldn't recommend having pre-cut bags, would you, for the first
not in the
few
first
months?
No, because it's going to change.
Yeah.
And through the lifetime of having a stoma, it's going to change as well at different stages, but most dramatically. So it is just keeping an eye to making sure that your template is cut, because any exposed skin, the enzymes from the stool or the urine is going to irritate the skin and break those barriers down.
So it's the end. Okay, that makes more sense. I just thought it was again. I just thought it's because if content gets onto your skin.
Yeah, but that's the enzymes in it that'll break down and change the pH of the skin.
See, this is why it's good to have a nurse.
I know, and
actual
it's
scientific
so validating
information
as well, isn't it?
But that's just one of many. I mean, you can get allergies as well, and you might have a bag for years, and then all of a sudden you start developing an allergy around it, and it's really strange. And I don't know the answer why. All of a sudden you'll develop an allergy. But again, if it's an allergy, you'll often find it's in the shape of the stoma bag. So that's a good indication of what it is. Other reasons for sore skin is if you've a leak, and that's not just if the template isn't cut right, but if you have put on weight or lost weight. Pregnancy, absolutely. Even just if you start to become more active, your needs are going to change. So it's really important that if you are having leaks, to link in with your stoma care nurse to get that reviewed. Because what a lot of people will say to me, I only have a leak once a week or that, but that's still too much.
And no one has to live like that, do they? And unfortunately, there are people out there that maybe, whether it's confidence or convenience or whatever, they don't want to or feel ready to approach a stoma nurse because they can deal with it, but that doesn't mean they should, does it?
Absolutely, And the thing about the skin, it'll break down so quickly, but once you get the right products on it, once you manage it correctly, it'll heal really, really quickly. I do
find that it can turn around as quick as it can come on, but I know when you're in that moment of sore skin, it can feel like all-consuming because you can feel it, you're aware of it, and you can know as soon as you've got sore skin, the leaks are going to come thick and fast because your bag's not going to adhere to your skin. And it's just, so please contact your stoma nurse.
It's that cycle of you have a leak, skin gets sore, there has to be something changed on it, but you don't know what it is. You put the bag back on, but then you've got sore skin on top of that, and that's going to continue that cycle until you break it.
It's so true. Because I remember when I started getting more active, I got more bag leaks. But I spoke to my stoma nurse and they went, well, why don't you try a 2-piece? Because it's a bigger base plate. And it was ever so slightly stickier. And then I got a 2-piece and I was like, this is game changing. But it was only because I had that conversation. Otherwise I would have been like, no, bags don't work. I need to get a new bag. And that was never the case. Like, do you know what I mean? I think
as well, it can be very overwhelming to see all the accessory products. And if you've got a problem like sore skin, it's easy to go, I need a seal, I need a paste, I need a this, I need a that. But it might not be as complex as that. It might just be a simple fix that, again, your stoma nurse can help you with.
I've seen it so often where it's just a resize of the template, just a change like that. What you said, just a change of the bag that you're using. How much easier is that than introducing something else to your routine? My motto has always been less is more, and the less that we need to introduce, the better it's going to be. But having said that, there's always needs. There's so many different accessories out there. There's always a reason for them. So it's just making sure that you're matching, and you're when you're introducing a supporting product or an accessory, that there's a reason for it as well, and that it's supporting you who has your stoma. I mean, you want it to fall into your normal day life as much as possible.
100%.
Definitely. Now, hernias is something that is a huge topic, and I see it a lot on the support groups on Facebook where people, again, they don't want to reach out to anyone because they don't think it's a big deal, but they're clearly worried because they're voicing it online. So when you're presented with a patient and they're saying, look, I've got this bulge, I've got this, that, whatever, where do they go from there?
And not to play it down by saying it's not a big deal. It's important that it is looked at and that we review it, but there's no need to panic with it. So it's getting that balance of, it is important that you have it looked at. I suppose the main concerns as a stoma care nurse that I would have if somebody has a hernia is that the blood supply is still getting to the stoma. So it should be that good pinky red colour.
And it's the inside of your mouth is a good reference, isn't it, for that? For the texture and the wetness and the colour.
Yeah, absolutely. So that's would be my main concern when somebody has a hernia. Unfortunately, they are very common, and it's the nature of the surgery.
Yeah.
So it always reminds me of, if you have a top and there's a little hole in it, all the fabric around that hole is going to be a lot weaker. So if anything is behind it, pushing into it, it's going to cause more damage.
Yeah.
And it's very similar. The surgeon will have had to cut through our abdominal wall, put a little hole in it. So all that muscle around it is going to be a little bit weaker. And our abdominal walls are fantastic. It holds so many organs in there, but there's a lot of pressure. So if there's any weakness in there, it can easily just push through. It's going to look for that weakness. And I'm always really conscious, but not if somebody gets a hernia, that not to say, oh, it's because of this or because of that. I can give you all the advice in the world and you can follow it and you might still develop a hernia. But there is ways to reduce it. And with a hernia, prevention is always better than cure.
So that's one thing I want to touch on, because when I first got my stoma, like I've always going to the gym, all those sorts of things. And I was so paranoid post-surgery, I'm not going to be able to work out. I was working out 6-7 times a week, if not more, like heavy weightlifting, all those sorts of things. Then I got my stoma, I spoke to my stoma nurse and they were like, yeah, fine. There's lots of different advice, not wait until 12 weeks before you lift. Don't lift more than a kettle, I've heard 100 times and all these things. What's the best way for prevention? Tips, garments, what do you recommend?
And that is so aptly timed at the moment, because just at ASCN, which is the Association for Stoma Care Nurses, back in October, there was a new guidelines launched around exercises post-surgery. So that's really helped us to be able to confidently advise patients on exercise. And what the guidelines would say is that we should be starting very straight away after surgery with even just abdominal exercises, for starting off with just some breathing exercises and then moving up. And it's like everything, it's not a one size fits all. So it's important that it's adapted. But that myth around, nothing heavier than a kettle, when I first started stoma care, I probably would have said that. But that's not true. It has to be tailored towards every individual, and the fact that you were doing it beforehand probably meant but I'm not a physio and I'm always really conscious of that, but I think it's really helpful now that we have those guidelines which will streamline, making sure that we're all giving the same advice.
That's amazing. I mean, I'm going to segue a little bit. When I had my surgery, I got post-surgery ileus, wherever it is when your stoma falls asleep, and the stoma nurse couldn't work out why I was doing it. So she was like, do you mind if I stick my finger into your stoma? And I was like, sure. But she went, gosh, you've got a really strong abdominal wall. She's like, wow, that's really strong. And then she was like, hey, doctor, come and have a look at this. Just put your finger in there. And I was like, guys, I'm still here. But but it's so true. She was like, you'll have no issues. And I was like, well, what if I'm worried about it? She's like, no, you'll be fine. You've got a strong abdominal wall already. So you can get out and start running. And then she was like, get off your chair then. I was like, it's day 3. She was like, get up, move. Get moving. And I was like, no, I don't want to do it.
Yeah. It's quite scary when you first move your body, isn't it? The drugs wear off after surgery. So you feel great straight after. Yeah. And then you're like, yay. And then you get all the pains in your shoulders and your pose, all those bits. And the anesthesia wears off. And then you're groggy. And then you're walking around. You're like, gosh, I was running marathons or training for it. And then I'm just going to do 4 steps. Yeah. And then stop. It's a big thing.
Yeah.
You have to start somewhere and just 100%. Taking your time with it and starting as early as possible. And it's just movement, getting out and moving.
One step at a time.
One step at a time, absolutely.
Now, the next topic we've got is blockages. And
hate them.
Yes. I mean, I think, is it fair to say that if you've had a stoma for a while, you've probably picked up what works for you in terms of blockages? So you may not get a lot of people coming to you for that. But if you've fresh out of surgery and you do experience that, I'd imagine it's such a very panicky, vulnerable place to be. And
I suppose you can confirm it, but it's so painful when you have a blockage. Yeah, and it's frightening as well. So what I would say is try and relax as much as possible. Our body and mind is all connected, and like that, you're scared. You don't know why this is happening, and
it's the tense and the anxiety of it all.
And you can just feel the pressure building and you're like, come on, fart, do something, come on. And then I'll move a little bit And then sometimes like that release, when it starts, and I'm like, oh, thank God, it's just like, let rip.
Because you see people online, we talk a lot about online, because a lot of people share their stoma journeys now and share their experiences. And the pain and the upset that it causes people it's heartbreaking. It's horrible. But yeah, what are your go-tos then when you have a patient with one?
The first thing I would say is try and relax. I know it's so much easier said than done, but our body and mind is all connected. So when we're anxious, our body tenses up. So it is just trying to some breathing exercises or some grounding exercises just to try and relax the body a little bit. You can also massage around the area as well. So just lightly massaging around the area. And don't, while you're having the blockage as well, try not to eat until it passes. But do sip some water and keep your fluids up as well. If it's not passing, I would go and seek medical attention.
I've had fews where
You've been in A&E with it, haven't you?
Like I've been massaging. I like lying on my side because I sometimes find that helps for me a little bit. Like, and then it's not moved, and then I've had to have like catheters put in it, like drain it, and all that sort of stuff. And it's just waiting for that release. And then I've also had because I'm not eating or whatever, then I get worried like, well, your kidney function's going down because you're not topping up fluids and all those sorts of things. So like blockages are natural. They may happen. So do exactly what Lucy's saying. Like when you're like, it's not moving, get to, doctors and A&E and stuff like that.
I've seen a lot of people saying they drink Coke. Or a fizzy drink. Is that fair to say?
It removes grime off steel, so therefore it'll get your stoma moving.
It move your poo?
I suppose it's the carbonated water which can cause it can cause a lot of wind, and going back to the ballooning, that it can also contribute to that. But it might just put some pressure behind it just to move it along. I've heard of people doing that as well.
It's a bit like a burst pipe, isn't it? Just like you just need to release that pressure and I mean, the feeling when you do whatever.
That's so good. Oh my God. Oh, honestly, when it just explodes, like but like, because it's been so trapped, it's that release of air, and thank God, like everything's okay.
It makes me feel sick. Because my stomach's turning, and like, I don't know, different for different people, isn't it?
Absolutely.
But
well, it's true. That's 100%. That's 100% true. But then I don't have a rectum. Well, sorry, start again. I don't have a full connecting pipes anymore, so I can't let a fart rip. So that's do you know what I mean?
That's true. Yeah. Isn't it amazing how much you miss that?
So this is what I'm going to go back to with this, because the next thing that I get this, and I don't know if you do, is I get rectal discharge. Like I get mucus that comes out of my bum. So I will say to my wife, I've got to go for a sit-down toilet now. And she's like, what on earth are you on about? And I was like, I need to now just sit on a toilet and just let like the mucus fall out. Yeah. And it's the only real sensation I kind of have to go into the toilet like a normal person. But for people who don't know what this is, because I don't think this is talked about enough.
No, could you describe what rectal discharges?
Absolutely. Well, the job of the large bowels is to produce mucus to help move the stool along. And then when you have a stoma, the bowel doesn't realise that part of the bowel doesn't need to produce mucus anymore, and it continues to produce it. Yeah. So we would normally just, in the past, you would just pass it when you're doing a stool. You just pass it in the toilet, and you wouldn't even notice it. But now it can build up, and it is a little bit scary for the first few months, and also sometimes what people can find very panicky is you might even pass a little bit of stool in those first few months if there was any old stool left up there.
5 years later with mucus. It's I mean, I haven't had Barbie butt surgery, so and I've got a loop ileostomy. Yeah. So for those of you that don't know, you've got an outlet where your poo comes out, but then you've also got another outlet which goes back down and is still connected to your rectum. So it's very possible that you can have it hopping from one to the other, and you can still let out some stool, which is also something I didn't realise would be a thing.
Yeah.
Is there anything like, for people that are worried about this, are there anything like, not getting too much into the mucus side of things, but if there's things people should watch out for if they're worried, like when to come and speak to a stoma nurse?
Absolutely. So it should be clear or yellowish in colour.
Okay, good.
If there's any blood staining in it, or if there's any strong odour from it, then I would always get that checked out, because it can be a sign of infection. But just to be mindful, sometimes food can cause it to to pass more mucus as well. And I suppose maybe with spicy food, all of that, you are activating the bowels a little bit more, so it is naturally going to produce more mucus when it's activated.
That's a fair point. Like, most people have a curry, then worry the day after. We don't have to, but I guess that's probably going to help.
With mucus, there are lots of things that can encourage it, as it can cause it more. So I know when I was pregnant, I experienced a lot more. When I was more active, I would experience it more. But would it be safe to say that people should, I suppose it shouldn't stop you doing these things, should it?
No, it shouldn't. But I think it's important to acknowledge that for some people it is a big issue, and it's strange, and I don't know the answer to it, but some people will experience a huge amount of rectal discharge and other people will experience very little. So it's very much individualised, and I think I'm always conscious that it's easy for me to sit here and say don't worry about it and continue on with your day. For some people it might be a big problem.
But if you've had it checked, and I know for me and you it is just part of it, isn't it? Unfortunately, and I, as a woman, I know I can wear sanitary towels, and there are things you can, they've got the pants now that you can wear on your period that can absorb, and you can wear them. As a man,
there's not a lot.
There's not, is there?
Mine doesn't I know some people who speak to me they have constant discharge, and I'm not in that bracket.
Yeah.
Mine has increased. I know it has. It would be once every few months. Now it's every couple of days. And even today, I'm I know, I'm getting this.
You can feel it.
Well, also phantom butt pain.
No.
It's that. Do you know what I mean? It's those sorts of things. But it's just, I don't know. I guess it's just sort of listening to your body, looking at the signs, as you said, and then if there's things that are changing, then go to speak to your stoma nurse.
Yeah. Absolutely. Do speak to your stoma care nurse. There's stuff that you can do proactively, sit in the toilet.
Yes.
I'd
With
say
your
the
knees
first
up.
thing, elevate your feet, and then that helps naturally open the anus there. And then it can be helpful just to wear a little pad or something to absorb it when you're out and about.
Yeah,
but I would say if it is a big problem, talk to your stoma care nurse or your colorectal surgeon if you're still in touch with them, because there is other stuff that would need intervention and recommendations from somebody who's tailoring it towards each individual. Yeah. So if it is a big problem, do speak about it.
Yeah,
I think unfortunately it's like with all these things, there's not a fix for everything, is there? No. And when you have stoma surgery, not everything can be fixed. There are going to be things that you do have to live with, and that's just the way it is, which I know sounds a bit brutal, but it's just being honest, really, isn't it?
Yeah. And look, I'm always really conscious as well that there is stomas out there that might have been done in an emergency. Yeah. They're not as easy to manage as you would like, and that can be really, really challenging as well. So even though we have all of these amazing products, sometimes it is just more challenging for people.
Yeah.
And I feel like I'd like to say quite fortunate with mine. I feel like you might be quite fortunate with yours.
Yeah.
My care's been quite good, but for people out there who do struggle, go speak to your stoma nurses. I've got something I do want to talk about, because again, this doesn't affect me. I don't know if it affects you. Pancaking. Other than eating these delicious sweet treats on, Shrove Tuesday or whatever it is in the middle of February, what is it? And why is it a big thing? And if people are listening and they're worrying about it, what can they do to help reduce this?
So with pancaking, it's the very opposite to ballooning. So with ballooning, you've too much wind in the bag. With pancaking, there's absolutely no wind in the bag. It's more common with colostomies.
Right.
But it can still happen with other types of stomas as well. But what happens is when the stool leaves the stoma, it gets stuck at the top at the opening, and there's no room for it to fall down. So it can then squeeze out. It's going to look for wherever it can go, and it can squeeze out under the bag then.
Oh, right.
So it can be a big issue. Ooh. There's lots of little things that you can do to improve that. So you can cover up the filters on it. So if the filter on the bag is too effective, most bags will come with little filter covers.
Yeah. That's what those are then?
Yeah, that's the sheet in the box. So my kids would use it as stickers. Free stickers, but no, they're a function.
I won't lie to you. My stoma nurse, they may have said this. I had no idea when I first got my bags. I was like, why have I got these rubbish stickers? And I threw them in the bin. I was like, I don't know what they are.
Sacrilege.
Well, I was like, why do I need them? I thought they were additional, in case the clip bits or whatever, if they don't work, you just put that on in case one of them fails.
I love innovation.
That's what made sense to me. Like, a bag's got to sit and it's not doing it. So that you use the stickers to cover the filter.
Filters to cover. Use the stickers to cover the filters. Yeah, absolutely. Now, be mindful if you are doing that, just to keep an eye on it, because there's no wind going to escape then. Nice. So just keep an eye that it doesn't go. Then the ballooning can happen. So just to make sure to take it off again. But you can also just make sure that you put air, so lift out the back of the bag and make sure there's air in it.
Again, then if you've got a closed bag, isn't there this gel or stuff that you can put in before you attach your bag to help it slip and slide?
Yeah, absolutely.
Away from the stoma.
So you can use a lubrication gel in it.
That's the
Some people will. I've heard of patients using olive oil or something like
olive oil.
Yeah,
nice.
Olive or vegetable. Any preference?
No, and I can't speak. I'm telling that from an antidotal point of view, because we don't have.
You're not recommending truffle oil to patients, I'm sure.
No, absolutely. What I am recommending is, and I always will, to go for a lubrication gel. Just, I suppose that's what it's designed for as well. So to put that into the bag.
I think there's a niche we could try and get olive oil on the NHS through prescriptions. I need it for my bag.
You cook loads, you'd use it. I just heat food up, so I'd have no use for that. But I mean, we have covered a lot of the main things that people talk about. But I want to move on to sexual health.
Yeah.
So this is something that at the ASCN I was there with. My children's hospital, and I experienced it as a patient and as someone that had a stand, and it was incredible. And I'm sure you nurses really gained so much from it when you go. But sexual health was in a lot of the symposiums, and it was the real buzzword for the event. So in terms of patients with stomas and sexual health, what is it that's topical at the moment? What is it that as stoma nurses you're being asked to consider now more than ever?
I think it's just opening the conversation. It's just having that conversation, and without making assumptions, without making any predictions, it's just allowing your patients to know there's a safe space for them to talk about their concerns, if there is any. But what research would say is that it is a big element, and especially you've changes with body image and all of that as well. So communicate would be my most important thing, and to talk about it, both with your stoma care nurse, but if you have a partner, just communicate with your partner as much as possible.
Yeah, 100%.
And for any future partners as well, just to feel confident that it's absolutely okay to talk about it. And there is so many there's so many supporting products there now to help enable and to empower people with stomas, and it's to utilise those as much as possible. And just to remember, absolutely everybody, the World Health Organization will say it's a basic human right, and it's really important that we talk about it and open up these conversations. And for me, what I've found has been most important to me in my role as a nurse is becoming confident about it, speaking about it in myself. When I first started stoma care, if I mentioned sex, I would have gone tomato head. I would have gone so red. And it's now, it's just the more I grow my confidence with it, the more I'm absolutely confident to talk to people about it. I know it's absolutely fine to talk about it.
100%.
And to open up to your stoma care nurse. A lot of people will feel that stoma care nurses who they feel more comfortable to talk to about it. So just make sure to. There was a survey done recently that showed that not all stoma care nurses are talking about it and confident in talking about it. So it is important that, I think, from where I feel from my role as a nurse, is to make sure that I am opening up these conversations and that we're very much mindful that it is an important topic to have, both pre-operatively and post-operatively as well. And I suppose because of the nature of the surgery, there often is going to be changes around the pelvic area. So it's just important to be aware of that as well, even if possible before it should really be discussed post-surgery if there pre-surgery if there is going to be changes there. And it's just having those conversations and find there's so many solutions. Actually, it was only yesterday I was at a psychosexual talk, and we were talking about empowering patients, opening up the conversations and solutions that are available out there.
That's really helpful.
What are the main things that people might come across to do with their sex life when they've had the stoma? Obviously, there's the mental aspect of it, the confidence and the change in your body image. But physically, what things can happen post-surgery that affects that?
That depends completely on the type of surgery.
Yeah.
So it's very much dependent on the type of surgery that you've had. So I think there's so many different elements to it. But I think that's where it's important that it's very much tailored to everybody as well. What I would say is just being confident in opening up that conversation and discovering how it impacts on you individually and the impact that it can have on you. Often what we find is that we mind read what somebody else is thinking, or we think, well, the nurse didn't bring it up, so I don't feel comfortable to bring it up. Or
so true.
My partner could have a problem with it and they have a problem with it, but actually we're not communicating and we're not saying, how do you feel about it? And the research would say that most of the time partners don't have a problem with it. It's just, but we can build these things up in our head if we're not talking about it. Don't you?
It's a real key point, because I remember during my surgeries, because I similar to you had it refashioned as well. My stoma nurse didn't really talk about it. They were like, "Don't put anything in it." Was what I was told a lot of, and I was like, "But that was it."
But I thought that would be obvious. Is it not obvious?
Well, again, I laughed and I went, "What do you mean?" She's like, "Well, we do get some people that will do X, Y, Z because you're a male," and I was like, right, okay, I guess that makes sense. Thank you for at least broaching the topic with me. But the thing that they talked more about for me was if I get my rectum removed, nerve damage ending, that could impact essentially getting it up, things like that, which is a big worry for a lot of men.
Yes.
So maybe there's things.
Well, you've done a series of men's specials. So if you haven't listened to that already and you go back, you'll see there's a photo there of the guys. You can see there. And you guys covered that.
Yeah, we did.
And you spoke about how your sex life was impacted with a stoma and post-surgery, and that was such a brilliant episode. So if
fantastic.
if you want to hear about that, then please go back and listen to them.
Yes, well,
we've got to ask you one final question, and that would be, from a clinical perspective, what advice would you give to someone who is newly adjusting to stoma life?
Again, like everything, I think that's such a broad question, because the reason why somebody has a stoma is going to play a part in it as well. For example, correct me if I'm wrong, but if you've an IBD journey, sometimes having a stoma can give you a completely new lease of life with that. And if you've been diagnosed with cancer, it can be a different journey, because not only are you trying to get your head around the cancer diagnosis, but now you also have stoma as well. So it just depends for absolutely everybody, and the reason why you have a stoma. I also think it depends if it's elective or
that makes
or an emergency. If it's somebody going for an elective surgery, I would say get as much information as possible. When it comes to surgery, look after yourself as much as possible, and be as healthy as you can going into the surgery, because it will stand to you afterwards. And also get as much information as you can around it so that you're prepared for it. If it is an emergency, probably my biggest advice would be kind to yourself. It is going to take a huge amount of adjustment afterwards. And I know I've had patients who woke up with a stoma and didn't even know what a stoma was beforehand.
I can't imagine what that must feel like. And it is, so it's, take your time with it. It is going to get it is going to take time to readjust to this. And there is also, when you have a stoma, there's sometimes what we call a hidden loss, or a disenfranchised grief is what it's called. It's where you've experienced a loss, but it's not seen by society as a loss. So you're going through all the processes, you're going through anxiety, anger, denial. There's often so much of it. And it's just important to be kind to yourself and all of that, and as you're going through that journey. And I would probably say as well, just to try and become as self-caring as soon as possible as well, because it will give you so much more quality of life, just being, and I shouldn't say quality of life, so much more independence.
I think for people as well, just that might resonate with that, all of those feelings are normal. Like, you know, grief, the change in your body, if it's emergency, like lots of people are going to go through that process mentally, physically, looking at themselves. Like, it is a normal process. So yeah, be kind to yourself. Yeah. And then fundamentally, like, you know, hopefully things should improve for you as well.
I always ask the question, would you talk to a friend the way you talk to yourself?
It's such a good point. Gosh, honestly, what would you say to someone else?
Absolutely not.
No, I'd be vile.
And the next question to that would be, would that friend want to be friends with you if you spoke to them the way you speak to yourself? And probably, absolutely. But
gosh,
so it is so important to be kind to yourself.
What you preach, I think, is
definitely,
And it's easier said than done, but
oh,
self-compassion is so important.
Yeah. That was such a lovely way to end the podcast. Like, seriously, thank you so much for coming. It's been an absolute pleasure having you, Lucy.
Thank you very much. Thank you.
You've been an absolute dream and honestly so insightful, so many useful hints and tips as well, which is going to really help so many people.
Thank you so much for having me.
No problem. I hope you enjoyed it and then see all of you next time.
Bye.